Practically speaking, aren't you out of time here? Insurance companies have set these premiums in place. That's how they're already in the mail for people to open and see on Saturday. What becomes the strategy after November 1st if this shutdown it lasts that long?
Well, listen, we want to reopen the government, and we need to stand by our hardworking federal employees who are doing all that they can to make sure that taxpayer dollars are spent effectively and efficiently, even under the most adverse circumstances. Remember, in terms of federal employees, the Trump administration has fired or dismissed more than 200,000 civil servants prior to them shutting the government down on October 1st. We want to reopen the government. Now, in terms of health care, part of the reality is that tens of millions of people are already receiving notices in October that their premiums are about to skyrocket because of the Republican refusal to extend the Affordable Care Act tax credit. And by the way, they have had the opportunity, both House Republicans and Senate Republicans, repeatedly throughout the year to extend the Affordable Care Act tax credits, and they've consistently voted against it. That's why we need action, not simply words, a wing and a prayer promise from people who have tried to repeal the Affordable Care Act more than 70 different times since 2010.
But aren't the premiums already locked in here, or are you saying Republicans are right when you can make up for it at the end of the year with the tax credit?
The premiums are not locked in terms of the reality that if we can act legislatively and act now, we can extend the open enrollment period. We can push it back, and we can intervene as a Congress in order to actually protect the affordability of health insurance for tens of millions of people.